Here at Access Eye, we believe in providing the utmost care to our patients. One of the ways we do this and one of the services we provide is actually specialty lens care. These lenses are not your average Joe lenses. They're actually designed specifically for you and require a pretty intense fitting process. And so today we'll cover some basic tips, tricks, and maintenance techniques that we'll need to know when we utilize these lenses.
So we've decided that we need a specialty contact lens, and when it comes to a specialty contact lens, they require some special care. In a lot of ways, they are very similar to the standard soft contact lenses that a lot of people may be more familiar with, in the first regards that you can store it in a case exactly the same way. That it will go with a solution, in this case Opti-Free Pure Moist, which is standardly what's used with the soft lenses. So there's multiple other options out there. This is just what we have in this situation. So as far as general nightly cleaning goes, your standard day of wearing the lens, after you remove it, what we're gonna have you do is actually use one of these here. So this one is a two-step cleaning process with the Boston Advanced. You could also get Boston Sim Plus, which is for some people a lot easier because it's just one step where you use one solution, rinse it off, and pop it in the case. So in this instance here, so we would take the lens and put it flat in your palm right here. And then we are going to use the first step of the cleaning solution, the Boston Advanced. Again, this one has the red tip. Have to be a little bit more cautious with this one. So put it straight up in there, a couple drops, and then just make sure you're cleaning the lens very well. And you can flip it over, clean both sides, make sure it's getting all cleaned. And then we would go on to the step 2 cleaning. Again, just a thorough rinsing. And then it is ready to be popped right on into the case there. And it should be good to go for the night. And then once you take it out in the morning, again, just make sure you rinse it off with the multi-purpose solution and you are good to go.
One mistake that we have seen with patients is to use the cleaning solution for insertion. This solution has a maroon or red cap. That means please do not put this in your eye. Here we have two different solutions for scleral lens fit. Two solutions that we usually use and recommend are Addipac in this pink vial and Sclerofill in the clear vial. These lens solutions are used to bathe and coat the eye inside the scleral lens, and we'll need them every single time we insert them.
Hi, I'm Dr. Thompson, and we are going to be demonstrating insertion and removal of scleral contact lenses. So with inserting the contact lenses, we use the large plunger to do so. So creating suction, you squeeze the plunger and place the contact lens right in the middle of it. Releasing the plunger will create the suction. We fill the contact lens with preservative-free saline. And the patient's eye becomes perpendicular with the floor. Lids go out of the way and she inserts by squeezing the plunger to release the suction, and the contact lens is on the eye.
For the insertion, it is very important that you fill the bowl so that it is overflowed. You want to see it actually overflowing a little bit. The more solution we can have on there, the better, because that minimizes the risk of having any type of bubble when you insert the lens. If there's a bubble when you insert the lens, it needs to be immediately removed and then reinserted, because that can change the fit, that can change your vision, and it can cause other issues with the eye. So we want to make sure there's no bubble.
This can be done with both a small or a large plunger. Which would you prefer?
I'll use the large.
Okay. So with the large plunger, what we do is the plungers have a suction ability. So we squeeze the plunger to create a suction, place the plunger on the front surface of the eye. It will create its own suction, so once you have contact, you can just simply remove the contact lens by pulling away from the eye.
Here at Access Eye, we're proud to offer these services, and if any of your eye care providers recommend this, we are happy to fit you in these lenses.